So to start with, just in terms of the background, what we're interested in is thinking about the prenatal environment and how that affects children's development, looking at what happens in the prenatal environment that might actually even affect us as adults in terms of our health outcomes. So in terms of maternal stress, we think about it in different ways. It could be measured as perceived stress, depression, anxiety, cortisol, placental corticotropin-releasing hormones. So there are many different ways, biological and psychological ways, of thinking about stress. And the reason we're interested in it is because there have been some studies that show that offspring are more behaviorally and biologically reactive to stressors. They might recover less quickly from a stress response. They might become less sensitive to negative feedback from stress response systems if they are growing up in an environment where the parent is feeling a lot of stress. Offspring also have a greater risk of preterm birth, low birth weight, neurological functioning, mental health, and physical health problems. So in this field, there's been different kinds of studies, but there are very few prospective studies in humans and limited data beyond the birth outcome. The majority of studies are middle class and mostly Caucasian, and fewer of the studies look at both the pre- and the postnatal environment. And there's limited data examining offspring autonomic nervous system reactivity. So what I'm going to talk about today is just give you a little background on the autonomic nervous system and why we think that's an important thing to study when you're thinking about the environment for the infant when they're growing up, just their gestational environment, but also after. So the autonomic nervous system has two branches, the sympathetic and parasympathetic, and as you can see here on your left, the sympathetic is known as fight-flight, and parasympathetic is rest and digest. And both of these systems affect all parts of your body. But what we know is that it's easy to study the cardiac effects of the autonomic nervous system. So what we do is we're able to measure indirect measures of the cardiac nervous system to look at both the parasympathetic and sympathetic nervous system. And we know that the autonomic nervous system is important because it is related to our brain. And there are different parts of the brain that affect different parts of the autonomic nervous system. So this is just looking at different aspects of our brain. When we measure the autonomic nervous system, I'm going to specifically focus on respiratory sinus arrhythmia and pre-ejection period. So respiratory sinus arrhythmia is a measure of our parasympathetic nervous system. And it tells us about the heart rate while you're controlling for respirations. It is also known as a measure of vagal tone, sometimes called vagal tone index. The pre-ejection period is our measure of the sympathetic nervous system, and that's really interesting because it actually measures the part of the cardiac cycle that is innervated by your sympathetic nervous system, so it's very specific. And it's the time interval from when your left ventricle is filled up with blood and the opening of the aortic valve, and we measure it in milliseconds. And so the way we do that is we are able to look on a screen at two cardiac waveforms at the same time, which is the EKG. Oh, yeah. So here's your EKG. And for the respiratory sinus arrhythmia, we're looking at the R to R interval, which is the different heartbeats controlling for respiration. And then when we do pre-ejection period, we're actually looking at two different waveforms, the EKG, the Q wave, and the B wave right here for our impedance measure. So from that, we can derive the two measures that we're interested in to actually look at the parasympathetic and sympathetic nervous system. So the target population for this study was to look at low to middle income, really, overweight and obese pregnant moms, because there was, in the literature, some strong evidence between socioeconomic status and stress. We also know that pregnancy is a particularly stressful time, especially for women who have financial problems. And the other issue is that the prevalence of pregnant women who are overweight, here is 56% of women ages 20 to 39 are obese or overweight who are not pregnant. And of those who are pregnant, it's up to about 60%. So for this study, what we wanted to do was to study these hypotheses. One was that higher maternal weight gain during pregnancy would be related to offspring's lower autonomic nervous system. And I also should say, and also their weight. The higher levels of maternal prenatal or postnatal stress would predict the greater offspring stress reactivity as measured by the autonomic nervous system. And that we've also hypothesized that prenatal and postnatal stress might affect the offspring's autonomic nervous system in different directions. So this study is part of a larger cohort study. The larger cohort study is called MAMAS. And that was a study that started with women when they were pregnant. And the sample was low to middle income women who were living in San Francisco, who were overweight or obese and pregnant. And they enrolled them into the study and then actually randomized them to 2 different groups to do a mindfulness intervention. Nikki Bush, who I've been working with, wrote a grant, which we call SEED, Stress Eating and Early Development, to follow these babies once they were born up to 5 years of age. So what we're looking at is the offspring of the mothers enrolled in the mamas. So the beauty of it is we have wonderful data from the mama study on the prenatal environment, and now we're looking at the infants after they've been born. So the design of the study is the prenatal environment here, which our stress measures and adiposity are done in the mama study, and then our SEED study is that we're looking at weight and the autonomic nervous system. And in the long term, we're going to be looking at outcomes like mental and physical health up until age 5. We're only up to age 2 right now. So in our SEED sample, we have 180 moms and babies, and we have 51% African American, 26% white, about 12.5% Asian Pacific Islander, 5.6% Native American, and 3.5% others. It's fairly evenly split between females and males. And in terms of birth weight, it was about 7% were large for gestational age. In terms of preterm, it was only 6%, 3.5% were over 42 weeks. 27% was C-section. And in terms of breastfeeding, 94% were breastfeeding in the hospital, 74% were breastfeeding at 6 months. And in terms of the income, it was low to middle income. In terms of the weight and measures and height, we did several different measures, and we also abstracted information from the medical records. And so at 1 month, 6 months, 18 months, and 3 and 4 years, when we see them for the SEED study, we look at weight and length, abdominal circumference, skin fold thickness. In terms of our stress measures, these are the measures that were collected in the MAMA study. And to look at pre- and postnatal stress, we have a measure that we're using, the Cohen's measure perceived stress scale. This measures individuals' perception of their lives over the past month as either unpredictable, uncontrollable, and overloaded. And so some examples are, in the last month, how often have you been upset because of something that happened unexpectedly? In the last month, how often have you felt nervous and stressed? And then this is rated on a Likert scale. So it's really kind of getting a sense of how stressed you feel in general about different things and hassles that happen in your life, and it's reflecting on the last month. So we were able to collect this measure as a self-report 3 different times, twice during pregnancy, and then we averaged those 2 together to reflect pregnancy. And then we have postpartum at 6 months. The range is 0 to 3.8. And what's interesting is the 3 different time points reflect the first time in pregnancy, second time in pregnancy, and third time postpartum. And you can see that once the babies are born, mothers feel a little bit less stress. In terms of the pregnancy stress measure, another one that we had was stressful life events. And this is different than the perceived stress. This is really events that happen that could have a major impact on your life. And we were looking at the number of events that are experienced and also how bad they felt about them and how much it impacted their life. We looked at 10 different life events, and it was completed 6 months postpartum, reflecting on how things were during your pregnancy. And I'll show you 76% experienced 1 or more event. And so here we have the type of events that we're talking about. So if you were homeless during pregnancy, if your husband or partner did not want to have the baby, if someone close died, if you're separated, divorced, husband or partner lost a job. And in the end, we added those up, and 76% had at least 1 event that was very stressful. In terms of the infant autonomic nervous system reactivity, I'm going to report today on the 6-month data, and we looked at the respiratory sinus arrhythmia and pre-ejection period. And you can see we have these electrodes. I guess the light's not that good, but we put 7 different electrodes on the baby, and it's connected to a cardiac monitor, and that's how we do the ANS measures. And I want to just show you a short video to show you how we actually collect the measures. It's a still face paradigm. And Dr. Tronick is the one who developed this paradigm, and it's about relationships. So during that time, what we do is we have our electrodes on the baby, and we're able to measure their physiologic response to this experience of this resting positive experience where you're looking at, baby's looking at mom and interacting, the very stressful one where she is what we still face, and then the recovery at the very end to see how the baby comes back. So let me tell you about our results. So what we found was that moms who had higher pre-pregnancy BMI, their infants had higher, it was more likely that their infants had higher birth weight. If the moms had a greater gestational weight gain, it was more likely that the infants had what we were going to say is a lower resting sympathetic activity, so that they had a dampening of their sympathetic nervous system. But when they were under a stressful condition, like this stressful condition, they had greater sympathetic reactivity and lower parasympathetic reactivity. So there was an autonomic response during this protocol. And this is one of the first studies that actually looked at the relationship between maternal weight gain and how it affects the infant's autonomic functioning. And the other thing about the weight was the infants had higher infant weight at 1 month of age, also was related to their ANS, was related to lower RSA and lower PEP reactivity at 6 months. And there's actually one other study that I used, a Chamaco study from Berkeley, and also looked at this phenomenon, and we found similar changes where toddlers who gained weight quickly, it actually dampened their autonomic nervous system by age 5. So what happened with the still face and the ANS? What you can see here is this is respiratory sinus arrhythmia, and the lower the measure, the more stressed they were. So during baseline, when the mom's playing with the baby, this is this child's baseline. And then when they're the still face, they got very stressed. And then you could see the reunion. She didn't come back right away. It was like, really, is this going to work? And then she came back up. So what we also found was, and because of time, I'm going to go quickly through some of these. This is that there is a relationship between pre and postnatal stress on our measures. And so what I'm going to focus on is what we found with stressful life events prenatally and how the reactivity looked. So this is just the correlation of it, but it's basically, whoops, I didn't mean to do that. So what you see is, again, lower measures here means that there's more parasympathetic reactivity. So the more stress the mom experienced during pregnancy, the more likely that they had in a reaction to with their parasympathetic nervous system. Also, if they had postnatal stress, it actually dampened their reactivity in a different direction. So what we found was there were strong relationships between mother's weight gain, and infant weight. Mother's weight gain during pregnancy is related to the infant's autonomic nervous system. And then these are some physiologic pathways that could explain that. And in summary, in terms of the severity of the significant life events during pregnancy, predicted greater ANS reactivity at 6 months, and also greater postnatal perceived stress, predicted less or dampened infant reactivity here. And some of this is probably related to the timing of when the mom felt the stressor of being pregnant during pregnancy, the stress during pregnancy, and also the type of challenge. As you can see with the still face, we're really looking at how physiologically babies are responding to mom's their relationship with the baby. We have some study limitations about our sample, about some of the measures, but we feel the implications are that it demonstrates a link between prenatal stress and the offspring's biological sensitivity, and it also points to some issues about method, how we report things, the timing of stressors, and what kind of stressor we're actually measuring. So this is our amazing team, and just to point out that this is Nikki Bush, who's the PI on the project at UCSF. And we have our funders to thank and a lot of staff who have helped out. So thank you very much. Yes, questions? Yes, Barbara?
What do you think the mechanisms are that would explain excessive gestational weight gain and increased reactivity? I mean, what it makes sense. Why? Well, there's a lot of obesity, increased reactivity, relationships in the baby, but why do you think that's happening?
Well, I think there's a lot of different pathways. And one thing that always makes me think about it is that we do know that cortisol passes through from moms during pregnancy to the baby. And so maybe having increased cortisol also affects the baby's metabolism, also brain development and the HPA axis. And so that can also have an effect on the autonomic nervous system. So that's one mechanism. And in terms of weight gain, one thing in the slide that I have on the physiology, if I have that, I could show you a little bit more. But I also think it has to do with if the moms have a certain amount of weight gain, that it could affect certain parts of, again, the baby's development and affect metabolic syndrome. And that could also be why babies have higher weight gain. Another thing is that there's been some research showing that moms who have a lot of stress early in pregnancy, it affects their sympathetic nervous system. Moms who have stress later in pregnancy, it affects the development of vagal tone. So there might be, and one is because in the first 14 to 16 weeks of pregnancy, that's when the adrenal cortex of the baby is being developed. So if they're stressed during that specific time, that can have more of an effect on the adrenal cortex, which could affect cortisol and other things.
So has mama shown that maternal stress is associated with excessive gestational weight gain to kind of close that loop?
Mamas hasn't shown that yet, at least reported it publicly. So I don't know what they are looking at specifically related to that, but we could ask, you could ask some of your colleagues. But there hasn't been any big presentation on that I know of. Yes?
Hi, Abby. Great presentation. I wonder, did the mothers who gained more weight, were they more stressed? Is there a relationship there?
So the question is the moms who were more stressed, did they gain more weight? When I was talking, yes, they did. But just trying to think of, there was, so there is a relationship, and there's confounding, because there's a lot of stress, there's a lot of weight gain, and both of those independently can affect the autonomic nervous system. So, but we did, in the analysis that we have, when we looked at the relationship between stress and ANS, we controlled for mom's weight and weight gain. So that relationship still held in terms of psychological stress, controlling for weight gain.
And then is the weight gain related to her pre-pregnancy BMI? How are you deciding what is excessive weight gain as opposed to expected weight gain for BMI?
Unfortunately, I don't know exactly, because that's the mama's study, and I know more about the babies. But that's a good question, but I don't have the details on that, so I'm sorry. Any other questions? Yes?
Did you find that excessive gestational weight gain was related to the infant reactivity? Did you also find that in BMI, pre-pregnancy BMI?
No, we didn't look at pre-pregnancy BMI predicting infant autonomic reactivity. No, we just looked at the relationship between infants' birth weight and their weight at 6 months and ANS. So I don't know about that.
You wouldn't have been able to really, because everybody who was recruited into mamas was obese.
Oh.
Right, they're all obese and overweight.
Oh. Okay.
Yeah, that's true. Thank you.
Thank you, Abby.